long does your nose hurt after rhinoplasty? So it's a process. Approximately the first week, you will notice that your nose is sore. If you lean over, if you blow your nose, if you do anything that puts a little bit of pressure on your nose, you will feel it. And it feels kind of like sinus pressure up on the sides here where we make the small cuts in the nose. The tip tends to be very tender, where if you touch it or accidentally bump it, it will be very tender, especially that first week. This gets better and better with time. And for most people, about 6 to 8 weeks, it's tender, where if you bump it or touch it, you'll notice it, but you don't think about it all the time. After that first 6 to 8 weeks, then it, for most people, is not tender anymore. This can be extended out to 3 months or so, depending on the person. But for most people, after that first couple of months, it really doesn't hurt. And the most of that discomfort is in that first week or so. Do they break your nose for rhinoplasty? So the way that I do rhinoplasty, I make very controlled, very small 2mm cuts in the bone on the sides. And this is if I want to make a bigger nose smaller or a crooked nose straight. If I am moving the nasal bones, that's how I do it. So it's an extremely controlled way to make these cuts in the bone to move them. So it's more like refining a diamond rather than breaking a walnut. Whenever you have a bump on your nose, this is brought down very gradually with something that looks somewhat like a fingernail file. And so this isn't traumatic, but it's a very slow, controlled way to shape those bones the way that we want them to be. Can you be awake during rhinoplasty? I have heard of people who were awake during rhinoplasty. When I've heard these stories, they were not particularly pleased about this. And as a patient and as a physician, I would not want to be awake. It is on your nose, it is on your face. Most people don't really like things happening with their nose and their face while they're awake. Some people will do this under IV sedation. And so this means we give you enough medication where you are not aware and you do not remember. And this is something that can be done. This is not general anesthesia, but it's very, very close. Or you can do this under general anesthesia where you're completely asleep and you don't remember. I like to do my rhinoplasties under general anesthesia. This way the patient is 100% comfortable and there is no concern for the airway. If you happen to have any drainage or anything like that that goes in the airway with general anesthesia, that's 100% controlled. So it is completely safe for the patient from a surgical perspective, and their comfort is top priority. So you could be awake during rhinoplasty, but that is not how I prefer to do it. Have questions? Schedule a consultation anytime. I help people like you every day. Thanks for watching.